Hi, everyone, and welcome back. I am here with a guru of many things today. I want to introduce you guys to Dr. Nicole Kozian. Welcome.
Yeah, thank you so much, Ginger. It's so great to be here, and thanks for having me.
Thanks for being here. My face is about to split off because I'm so happy that you're here because you're an expert at so many things. So you guys, for those of you who do not know Nicole, I want to give you a little introduction to her, and we're just going to be off and running with so many good things that we have to talk about. She's the founder of a bunch of stuff. Pelvic Sanity, for one, which is in Southern California. That's her clinical practice. And Pelvic PT Rising, which is business coaching and continuing education and all things elevating the status of pelvic care and healthcare in the US and beyond, really. She's also the author of the IC solution, that is interstitial cystitis, for those of you who don't know. She runs the Pelvic PT Rising podcast because she needs hobbies. And the Pelvic PT Huddle, which is a great group online, which I have interacted with quite a bit. She's also the co-founder of Pelvicon, which is the first conference of its kind because it's by and for pelvic rehab, which is fantastic. And I think it sold out like right away again.
Again, 3 years in a row.
Yeah, all right. She was named the ICNPT of the Year and the first PT to serve on the ICA Board of Directors, and is a Chapman University Alumni of the Year, which is, of course, where you graduated.
Yes.
All right. Whew, that's a mouthful.
Thanks. I know.
Yes.
Thanks for that. I know sometimes when you see all of the things, it's kind of like, oh man, I've
Yeah.
done a lot of stuff.
Feel good
Um,
about yourself today
yeah, it's like
and
a good
tomorrow
start to today.
and the next day. And that is a perfect place to start because here's the deal, or here's what I think the deal is. And you can correct me if I'm wrong. I think that because you're a new mom,
I am.
congratulations,
Thank you.
as a woman, as a new mom, as a small business owner, and as a therapist. That's a special kind of caregiver, I think, as a therapist. We grow up with this conditioning of achievement and caregiving and leaning in, and you can do all the things that you want. And then, well, that's kind of a full sentence. It's like, and then you make choices and you realize that maybe as a woman you've got to work harder or be a little smarter or speak a little louder or do it in uncomfortable heels or whatever. And then you notice, and I'm pretty transparent with my story too about struggling with everything that happened with, I had infertility for such a long time. I thought, well, I'll adopt, or my patients are my kids, my business is my
Right.
kids, that kind of thing. There are so many pressures on women. And in the United States, a complete lack of actual support for moms and families, because where mama ain't happy, nobody is happy.
Yes.
And since we don't have any maternal and paternal leave and support, that's a lot of stress. It's a lot of pressure. And it's not just on the moms, it's also on the dads. Some dads stay at home, some moms stay home. So let's just start there. You have Clay, who is, I can't wait to meet him someday. Welcome to the world, Clay. He's almost 1 year, you said already?
Yeah. Yes.
Oh my gosh, this is where you wish that I wish that you could just like flash the cute picture, but we don't want to put our kids all over media, that's for sure. But I can't wait to see him. Tell me a little bit about that story and your progression, because with everything that you have done, I do seriously want you to like stop and give yourself credit for that, and then tell me how hard it was.
Yeah. Right. Give me the real scoop.
Yeah, yeah.
Well, so first of all, I think one of the biggest realizations that I've had to sort of grapple with and am still grappling with is that when you go from when you go from being on point on your schedule, on I can do all the things, I can schedule whatever I want, I can do whatever I want. Um, I'm objectively crushing at a lot of things. And then boom, you think that postpartum is just going to be this period of time that you have to get to, right? And whatever that is it 3 months? Is it 6 months? Is it what ACOG says of 12 to 18 months? Like, you just feel like you just have to get to this one point and then it will all be better, right? I just have to get through this period.
Oh my.
And what I've really come to realize with quite a rude awakening is that it's changed forever now, in terms of the lack of control you have over your own life,
Mhm.
schedule, and things just become a little bit harder. I actually joke a little bit, not it's actually not very funny, but some of my staff, I used to um, be understanding as much as I could be understanding of my patients that were new moms, that were calling, that were, late canceling, that were saying my childcare fell through, I can't come in, and, being admittedly slightly annoyed at that sometimes and being like, oh, people in this postpartum phase, if they would just put themselves first, that's what they need to be doing. And I had a big meeting with my staff. I mean, it's like comical now that I look back and I was saying that. But I had a meeting with my staff, you know, in that early postpartum phase. And I was like, okay, first of all, we need to change all of our birth prep and pregnancy program at Pelvic Sanity. Secondly, we need to switch all of the postpartum program. But thirdly, what I really wanted to sort of hone in on was that, man, it is a miracle that any mom can make it to any appointment and even think that they're trying to maybe put themselves first in that first, for sure year and beyond, honestly.
Mhm.
Because what's shocking to me is the amount of immediate feelings of it's not about you. Like, suddenly your priorities are completely turned up on side their head. And for someone like me who's I'm a little bit of an, quote unquote, wonderfully geriatric age pregnancy.
Yes. I know about that
Every
too.
cringe, right? But objectively, I'm like, older mom. I had some fertility struggles. We had miscarriages and loss, and we had to do IVF and all the things. And I've talked openly about that on the podcast. Um, so, but having been through all of that, you know, in did even that didn't prepare me for the immediate change in priority, and just the realness that brings, and it's been actually really challenging for me, with having all the things that you just mentioned are just now used to be like top thing, and now they're just not.
Yeah.
And so I'm sort of starting to like recalibrate what's important, and how I'm going to be able to still get it all done. Um, so
Mhm.
thank God for my husband, Jesse. I have a great family, I have wonderful support, but even with that, it's still really, really hard. And thanks
Yeah.
to my mental health therapist
Oh,
that I
yes. Shout
had,
out to that right now.
dude, shout out. Because honestly, like, and thank goodness that I took that leap. I did mental health therapy and EMDR all through my fertility struggles and miscarriages and stuff. And that really gave me, I think, a great foundation for being able to have these challenges, and be okay with being like, I think I need some help still. Like,
Yes.
that journey is not over. So
Yes.
100% love my therapist, and really I'm thankful that I have the ability to see them.
Yeah. So there's like 2 points here. One is for moms listening, um, you can stop beating yourself up now.
Yeah.
Because if you're listening to pelvic PTs talk, and we didn't even talk about doing the pelvic PT that's required postpartum, right? And if it's hard to get to do all that, and we have freaking degrees in this stuff, then we can all just exhale a little bit and go, okay, all right, I'm not going to beat myself up. And the second thing that I hear too you saying is, and is I want to say to everyone, um, who pays mothers less for every child they have, and for the gender pay gap out there that is a real thing and exists. It's so freaking backwards because for every kid you have, sometimes pets can be included with that. They're kind of high maintenance too. Um, you are a taskmaster. You have to become more organized. You have to have better structure, better infrastructure. Your time management is like razor sharp, and it's out of necessity, you know?
Mhm.
So that's the other piece of that, as is we get more competent, not what the research shows that society thinks and pays us for, which is less competence. Men with children get paid more, women with children get paid less. It's like, okay, well, let's just speak to that now. No way. You become, multitasking does exist.
Yeah.
That's what mothers do. So I just want to shout out to all the moms out there, to you, Nicole, for, you're already working on those kind of razor sharp skills of getting it all done, of running a clinic, of running a continuing education and coaching company, and putting yourself out there with a podcast and with the conference and everything that you're doing, and continuing to write, because those are the things that you love. But it's also born out of, I think, the passion that you have, particularly for IC.
Yeah, absolutely. The one other thing I'll add to that, Ginger, because that was a great summary, is that I don't want anybody else either. One of the things that I came to have a real self-realization about was that, I thought that maybe there was going to be a part of me that was going to want to be stay-at-home mom and really, really put my focus there. And I was able and had the luxury of being able to take an extended maternity leave, because I have an amazing staff, and we worked really hard to be able to take as much time as I wanted and needed away from at least the brick and mortar clinic. But there's a lot to wanting to go back and wanting to still continue to do those things. And then the mom guilt comes with like, well, what if you really think about it, the priority is Clay, but also it's okay to have goals and aspirations outside of taking care of him. And so that's another thing that I've been working really hard on, is to allow that to be okay. And that, yes, it's okay to have childcare and and still have those professional aspirations. That's okay. Those things can coexist. So for any working
Yeah.
mom out there that has any of that guilt filled in, to be like, oh, should I stay home? Am I missing out? What should I be doing? I just want to say, it's okay to have those goals and aspirations. And it doesn't mean you're a bad mom. And it doesn't mean you don't want all of the things for your professional life, because those things can coexist. It just takes a lot of work and a lot of self-awareness and support. So
Yeah.
that's one of the things too, I was very surprised at, where I was like, you know what? Like I do want to still continue to crush at this other stuff. Like I want to keep doing it all. And so we need to have a little bit different expectations about what that's going to look like.
Mhm.
But also it's okay to still have those goals.
Mhm. Yeah, I think that, if we consider this is 2023, look back to 1923, 100 years ago, when even hand washing between birth deliveries was being made fun of, like it wasn't a thing. That's a whole other story in itself if you look at the origins of childbirth in the United States. Along the lines of not even knowing what hygiene is, comes that heavy social conditioning that women's only identity was to give birth. And
Yeah.
and so that's like epigenetically, it's like code written into us. And so
Mhm.
I think of the guilt that I used to have, like a piece of luggage, like, well, it's time to pack the guilt bag for the day. How heavy is this damn thing going to be today?
Yeah.
We can swear, by the way. So,
Oh, cool.
so we can
Unleash.
dig in, because this is what we do get passionate about. It's our lives, it's our livelihood, and it's important. It's important enough to swear. Um, and I had to give myself permission, like literal verbal permission. I was going on a trip. It was 20 or so years ago, and I was about to teach a course. It was probably a California thing where I had to go a long way. Yes, it was. And I was going with my middle son. He was still nursing. He was like 6 months old. I can't leave him. I have to
Right.
take him, you know.
Right.
And I had to say out loud, this is, I can do both of these things. This is not outlandish. This is not selfish because I want to work. You know, nobody says that to dads, right? Oh, you want to work and have a kid? Oh, you can't have it all. Nobody says
Yeah.
that. So I hope that, you know, and we've heard this stuff before, like put down the guilt and all that, but I think we need to hear it again and again and again to kind of banish it out of the, you know, the kind of the epigenetic impact that it has on us as women, because we all know what that feels like. As soon as you say that, you know, the guilt thing and giving yourself permission, we're all like, yeah, yeah,
Yeah. You know,
yeah.
one of the really cool moments of this last Pelvicon, and you mentioned Pelvicon. Pelvicon's a big pelvic health rehab conference that I co-founded with one of my really good friends, Jessica Rial of Southern Pelvic Health. So Clay was 8 months old or so at the 2023 Pelvicon. The 2022 Pelvicon, I had to go. I was in the middle of a high risk pregnancy, right? So had to like talk to my maternal fetal medicine doctor about like, so why do you say I can't travel right now? And then I made the decision to still go, with his blessing, of course, but reluctantly. But so he was in my uterus then, and then it was a very triumphant moment in 2023
Oh
where he was
gosh,
there.
yeah.
We actually changed the game a little bit. We actually had a breastfeeding feeding family room so right outside the conference. We live streamed the conference into that room so that anybody that had a little one, needed some family time, could come right there, not miss anything of the conference either. And so, but
That's
one
so
of the most
awesome.
triumphant moments of 2023 for me was to introduce somebody in the pelvic rehab field who is sort of paving the way in terms of fertility. It was Yanni Abraham. So I got to um, introduce her on stage with Clay. And I was like, this is like such a cool full circle moment. You're mompreneuring, you're still here, you're running this huge conference with him. And it was a really cool moment. And then right after I introduced her, I like ran into that feeding room and breastfed him, and then and then handed him off to someone that was helping me take care of him for that conference week, and then went right back out onto the stage.
Yeah,
So it was a really cool just moment
that's
of like, yeah,
so
you know what, we
awesome.
made it work. We can do it.
Mhm.
We did it. We're doing it.
Yeah, yeah. I'm already thinking of like the adrenaline high from after that. I'm like, did you sleep for the next 3 days?
Yeah. Oh,
Because you know how it is after
so
you
great.
speak or something, you're like, you're up there.
Yeah, totally.
Yeah. Oh
Yeah.
my gosh. Um, so talk us, how was the birth process? I mean, for you, because it's one thing to talk about it, you know, mom to mom, but we're talking about it pelvic PT to pelvic PT, you know, also on top of it. So
Yeah.
how was it?
You know what's so funny is like, we do this for a living. Like we have a birth prep program at Pelvic Sanity. We teach people how to push. We teach
Mhm.
people how to, advocate for themselves during the process. And we do have the birth preferences and the partner things and all of the stuff, right? We do the labor positions where your pelvic floor is the most relaxed in. We do perineal massage. We do all of it. And I will tell you, I was so freaking humbled during this whole process. My birth was I had the goal of doing an unmedicated vaginal birth, and I was able to do that. And it was
Yay.
the birth itself was really amazing. But one of the things that surprised me the most, and I did all my birth prep with some of the PTs at my clinic. I was feeling super confident. I worked with a really great doula who helped with with my mindset and all the things. And my labor was actually from start of contractions to clay in my arms was only 5 hours. And for a
Oh,
first
wow.
time
That's
first
fast
time
and
birth, that's
furious.
fast.
Yes, that's
I
fast and
kind of don't even
furious.
realize that that was happening
Hmm.
at the time. And got to the hospital. It was already 10 centimeters. They were like, okay, in the wheelchair, I was getting the
The
urge to push
feeling.
and all the things.
Uh-huh.
So, but what was interesting is that my pushing phase was actually a little longer than I would have probably, anticipated on paper if it would have been a multiple choice test.
Hmm.
I could not, even with all of my experience. I literally do this for a living. I've been doing it for 18 years, teaching people how to have a vaginal birth. I could not figure out how to generate that type of force. Um, and so what was interesting about that whole process for me, I had a hard time. Like I finally figured it out. And then, he popped out, a couple pushes later, but it took me like an hour
Yeah.
to figure out what I needed to do. My midwife was amazing. She let me do all kinds of positions. The position that I thought I wanted to be in wasn't it. So all of that prep work of the mental prep work of really just letting go and being prepared for everything and nothing at the same time was
Hmm.
really what ended up happening. I barely tore. It was on paper, it was awesome. But then I came back and I was like, man, why could I not figure that out? I cannot believe it. I can't believe that, right? I cannot believe that it took me an hour to figure out what the hell was going on with that pushing phase.
Yeah.
And I ended up actually popping a freaking blood vessel in my eye because I literally, like, I was breath holding, I was doing all kinds of stuff.
Oh, yeah.
All the things you weren't supposed to do, right? But,
Yes. Yeah.
and I put that in quotes, like, weren't supposed to do. I feel like
Hmm.
one of the major changes we've made at at Pelvic Sanity with our birth prep now is that, you know, we now talk about an optimal birth, right? An optimal way to push but at the end of the day, like when you're in that moment, like sometimes that might not be the way. And I think to myself now, I'm like, gosh, we need to really make sure our language is on point so that we don't make people feel
Yeah.
bad about not being able to figure something out the right way, or open glottis pushing. We all talk about being able to breathe your baby out. Well, if that's not working, then what?
Hmm.
And in my mind, as my midwife was trying to coach me in I needed to generate some downward pressure in order to get Clay to move to a different position. And I remember being like, no, 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 I don't want to do that. Because it's like
Yeah.
those things in your head are like
Hmm.
opposite. And then
Hmm.
I was like, actually, I'm just going to freaking go for it. And then I did it the quote unquote wrong way, and he popped out. So I don't know. For any practitioner listening, I feel like that's a great lesson in, when you're in the moment, or I think about how I was before when I hadn't had that experience. I
Hmm.
hadn't had a baby yet.
Yeah.
And not to say that you have to have any experience to be a good practitioner. You absolutely don't. I believe that you can have any sort of experience and still help people well. Um, but there's a little bit of a difference. I think we need to prepare people for if things don't go the way that we exact want them to, or the exact way that is optimal that we're teaching, that it's okay to move to
Yeah.
this other type of way.
Yeah. Yeah. I liken it to, I'm just thinking about, my birth experiences when you were saying that my first was 36 hours, but the second one was 4, So
Yeah.
I'm feeling your fast and furious birth. And the third one was 5 hours. So it was also fast and furious. And I'm thinking about the pushing phase when you also feel like, and I tell all of my moms this, um, it's almost like I get really close to the mic and a little quieter when I tell them this. I'm like, you're gonna want to give up when you get to transition. Just saying, I don't care. Like every single birth, I coach it all the time, and then I've given birth 3 times. I still thought that I could somehow quit and not and not finish the birth process because you're
Yeah.
you're in another place.
A
You're in
hundred
that
percent.
place where the eyes are a little glazed over. You
Yep.
are tired, even if it's only been 2, 3, 4, or 5 hours. That's still a marathon. You've been running that marathon for 4 or 5 hours. You're still exhausted. And so you get to a place where your body, like you physically are depleted, even if like you can eat, you can drink, you can do all the things that used to be, air quotes for those of you guys listening, that used to be, not allowed, of course, is now, and you can still just physically not have, the to do it. It's kind of like if I had to, or anyone, I think the most nerve-wracking thing you can do, in addition to giving birth in public with lots of people around you, and you have, right,
Right.
is yeah, bear down and push this out, and with everyone looking at you, is to sing, in public, like the national anthem, where everyone is staring at you, and you've got to get it right. Like I might as well be pushing a baby's head out of my vaginal canal with a mic,
Yeah.
and when you got to hit that the note, because like something like the national anthem is so big in range, it hits
Broad.
my whole range, top range to bottom range. Um, it really doesn't matter how you get that note out. If you are singing that in front of 8,000 people, it's like you're going to get the note, even if you slightly do it wrong.
Yeah. Yeah.
You can go back and revisit that later.
Right. 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 We can debrief about that. We
You can
can,
debrief
but in the
all you
moment.
want, but in the moment, you got to get it out, whether it's the note, the baby, the whatever. And so I think about a music analogy, vocal analogy with that. Not to mention that the voice is so important, for the pelvic floor.
Absolutely.
Yeah,
Yes.
yeah. Oh my gosh.
So a lot of changes though from having the experience and and I think there's advantages to both. At Pelvicon last year, a really awesome physio named Taryn Hallam spoke and said, we were doing like an Ask Me Anything panel, and she said something so cool. She said, if you haven't had the experience of having a baby, the cool thing about that is that you're not biased. Your experience isn't biased how you speak to patients or how you teach birth prep, right?
Hmm.
And then if you've had that experience,
Yeah.
then you can use that, to your advantage. And there is something different about having been through it, even though my N is only 1, right? Your N
Hmm.
is 3.
Hmm.
So there is something to be said for advantages on both sides of that. And I thought that was such a cool way to look at it.
Yeah.
One is not necessarily better than the other.
Yeah.
But it
Shout
is
out
interesting
to
to know it. And
Taryn.
as a patient, it'd be interesting to know, like, hey, do you have experience or do you not? Because then that can influence how you train patients. It can influence what you say to people either way. And so it's kind of good to just know who you're learning from in that way. I think that would be a great question for anybody to ask. And as a practitioner, you shouldn't take offense if anybody asks that, right? It's just
Right.
information.
It's part of people's preferences, and they have that right to choose. And people may want to choose practitioner for different reasons. And
Absolutely.
yeah, so yeah, shout out to Taryn Hallam for her awesome work with pessary fitting and just in all things knee deep in research,
Yes. Yeah.
which is fantastic. So let's talk a little bit about. Wait, let me back up 2 steps and shore up that last piece of the conversation,
Yeah.
because there was one more point, and it's going to linger like back burner in my mind unless I say it. And that is, I think that the physical prep for birth, that's like, whether it's all the lifestyle medicine pieces of staying healthy and feeling good prenatally and preparing to push, and doing birth coaching, which you guys listening, I highly recommend you seek out a pelvic PT or OT, because they're going to give you the most customized, compassionate, open-minded, evidence-based care when it comes to birth prep. um,
Yes.
a lot of people think, I'll just go to the hospital class. Well, the hospital class is really about preparing you for hospital policy. It's not
Yes.
really preparing you for birth. Not that they can't have that there, they can. But historically, that's not what the hospital classes were necessarily about. And so when you seek that independent voice, you are really getting your goals met, for whatever kind of birth you want, that pelvic PT or OT is going to help you accomplish that.
Absolutely.
And so just shout out for that. But the other piece that I wanted to shore up was all that physical prep is so important. But I think the mental health prep is equally as important.
1,000%. Yes. So however somebody wants to do that, um, mental health therapy, hypnobirthing, Bradley, doula, whatever, it just needs to be something. And hopefully it's a doula that matches with your, personality and and all of your other alignments in your life that hopefully
Yeah,
that person can help. But man, highly recommend that. And there's a lot of pelvic floor rehab providers now that are adding doula type services to their repertoire, which is awesome. I love that as well. So it's just a good other little lens to look at. But man, that mental health prep, whew, important.
It takes a village. Um, and you might be able to, for those of you listening, you might be able to just simply ask your pelvic PT or OT, because everyone who is in practice typically has team members that they go to, because we realize how important it is to have a village, that nobody can do all the stuff alone. We just can't.
Right.
Nobody's good at everything. Which is a good segue to ask about your whole experience with treating IC, and the whole explaining that to the audience of painful bladder syndrome, and what is that, and how did you get into it? How did you develop such a passion for it and decide, I think I'm going to pop out a book on this?
Yeah. It was actually a really organic process with that. So, when I first went into pelvic floor physical therapy, I had the luxury of being trained really well, really early. And part of that was because I was hired actually not for pelvic health, for ortho, and then asked to do build the pelvic program at this hospital. So I reluctantly at that point said yes, ended up falling in love with the specialty, like most of us do, just with the way that we can impact people in a different way, I think, than, oh, my knee hurts. It's very different to have, someone come in with vaginismus, which is a painful penetration, involuntary spasming of the pelvic floor muscles. The person like that coming back to saying, I can not only have pain-free sex now, but I'm also pregnant. I mean, those are the kinds of things
that's just
the best, right?
Yeah.
So I ended up getting paired with, at the hospital, a urogynecologist who was also really sort of up and coming in the local medical sort of realm in Orange County. And his passion at that time was interstitial cystitis. And so he was doing some sort of newer, he was doing bladder cocktail type installations before those were really like a big thing, and recommended by the AUA and stuff. And so he was really doing some neat bladder centered treatment, which is what they can do, right? So I was sent a lot of interstitial cystitis patients from this urogynecologist that we worked really closely with. And so I happened to not only be a newer pelvic health PT, but also then got these really chronic pain, complex people really early on in my career.
Tough to treat straight out of the gate.
Yeah, really tough. And so I had a great mentor. I had some really good training. And I also at the time had the luxury of time, right? So I would go home and I would just do deep dive research into, man, this person seems really bad. Like, I don't know what to do. And they said this one thing, and does that make sense? And so I would do my own independent research. And what I ended up finding was all of the misinformation that patients were essentially reading about interstitial cystitis. I would look at the PubMed research articles and some of the other things, and I'd be like, well, that doesn't match up. And so I started to really question some of the things that I was seeing. I was like, well, my patients seem to be really doing well when we're addressing the pain component of the condition and the pelvic floor component of the condition. And they're getting really good medical care for anything that they need to on that end. So why is, when I'm reading, does it say this is an incurable disease, that, all these doom and gloom things about
Catastrophic. Yeah.
yes. And so that's what initially was my impetus to put out a resource that was not only evidence-based, but it was hopeful and helpful and
Yeah.
practical information that people could use. So I wrote it for patients, but I also, in the back of my mind, wanted any practitioner that picked it up, I wanted them to see that, like, we had done a really good job researching all of the conditions as well, and actually diving into the research about them, right? So, for just to give you one example of something that we ended up finding, is that, a lot of people would say, oh, it's a women's condition. There's, the average age of diagnosis is 40, and women in their 40s are typically people that get interstitial cystitis. And, you look back at the little superscript about, let me go to that article, the one that they're citing. And most often anybody that was quoting that stat, it came from one article that was one county over a 20-year period of, I'm not joking, like less than 20 people. And the majority of those people happened to be women. And that's what everybody was just quoting. And then when you start to look at the chronic prostatitis type literature, and the fact that those conditions are very likely overlapping, if not the exact same thing. And so now all of a sudden it's like, well, men get it too. And if you look at the actual prevalence of bladder symptoms and the concurrence with pelvic pain, the overlap is much greater, and the numbers actually come out to be a lot more similar for both genders. And so it started to really enlighten us to those kinds of things. And I think that that's been my passion for a long time, is making sure that people have positive, practical, evidence-based information about a condition. And even though interstitial cystitis is a chronic pelvic pain condition, that people can still live really well, to use your phrase, can live really well with it, and can even come out of it symptom free. And I feel like that in and of itself, the belief change that now becomes a growth mindset instead of fixed mindset. I have this condition, it's going to be like this forever, I have to learn to live with it, versus I can change my symptoms. My symptoms can have the ability to significantly decrease, if not go away, is just that in and of itself, I think, is therapeutic. And so that's really why I have the passion for the condition. I love treating it because people get better. And it's so amazing to see that the change in their demeanor, the change in their life, when they realize that their life isn't over and they can do whatever they want despite their quote unquote diagnosis.
That, when you first started to tell your story, first I was like, I want to jump in there and go, yes, for decatastrophizing what basically, and we I'm not necessarily blaming, like, we're going to blame the medical profession, we're going to blame the journals, we're going to blame, it's not about blame really. It's about the mindset that our healthcare system has had in its tiny little evolution of 100 years or so, right? Is that you have worked to end that catastrophization of a condition that never had to be that way to begin with, which women and men alike, and any person who would get it, might have before felt like it was the end of their normal life as they knew it, like a death sentence. and it really isn't. Because when you talk about some of the symptoms, and that's my next question, is just give people an idea of what it feels like for someone to have it. Because in seeing patients that come into my practice, to see their faces go from that, devastation, I've seen 3 or 4 people, I'm never going to get better, to them coming in and going, I feel pretty good lately. I don't really know if we need to do much today. Can we just
Yeah.
talk about some prevention? Like I'm going to wherever I want to prevent a flare, let's talk about nutrition or whatever. So tell me what people come in feeling like.
Yeah. So the overwhelming majority, I think, of symptoms that we hear people say is that I feel like I have a UTI times like 1,000. And what can be really sort of difficult is that maybe it started as a UTI. The UTI clears and then the symptoms stay and persist. I think some of the more severe cases are, it feels like there's glass shards in my bladder or urethra. It just burns like crazy. It either hurts to pee or I feel like I have to pee every minute. And if I don't go, even though I go a trickle, it starts to become painful, like it's the fullest bladder I've ever had. Those are really like distressing
Awful
symptoms.
symptoms.
Those are awful. I mean, we all have had at least
A
one
UTI,
experience
right?
where our bladder has actually been full and it creates pain, right? On a long car ride, we can't go somewhere, whatever.
Or a
And
UTI, most
we've all
people have
sort of,
felt
that's a
UTIs
familiar,
feel terrible. Yeah.
that's a familiar feeling, at least for most people. And man, having that all the time, you can
Can't function.
can't function. And the thing that I talk to my patients about, it's like, we're neurologically wired to care about that more than if my elbow is hurting. So it's also not like, it's not surprising that we end up with all of the brain changes with the chronic pain part of it, because your body's paying attention more to a really, really important organ of our body. Not to mention that it has some of the most high density of nerves in the nervous system. Your bladder is like a really sensitive organ just to begin with. And so, that is, I think, what people mostly come in with. The technical definition is that you have to have 2 major things, right? You have to have some sort of irritative voiding symptom. So urinary urgency frequency, meaning you either have to pee a lot, you feel like you have to pee a lot, or you actually are peeing a lot, in the presence of, and this is key, in the presence of some sort of pelvic pain. And so and that's why sometimes it's called painful bladder syndrome, bladder pain syndrome. There's a million acronyms and it's all confusing.
It is.
And then the United States, it's different. So we call it IC. Most everywhere else, it's only IC if you actually have ulcerations to the bladder lining. But all that being said is that there are those 2 major hallmark signs of the pain part and the some sort of bladder symptom part. But one of the things that I feel like most people, I always just mention this, and I want to shove it down everyone's throat, is that just because the symptoms are primarily bladder does not mean that there's anything wrong with the organ itself in the majority of people. And that's, I think, another major mindset shift for patients, because it's like, I feel like that's happening. I feel like there's something wrong with my bladder. What do you mean it can be my pelvic floor or my nervous system? That is like, but I have bladder symptoms, so something must be very, very wrong. And that's your brain talking, right? Because your brain is making it seem like that, so you pay attention. But the actual cause of bladder pain syndrome can be, and in the majority of cases, is at least in part pelvic floor related, and how your nervous system is responding to that sensation. So, but that's one of the really amazing things about it, is because then we know we know what we can treat, we know what to do. And it's also why a lot of bladder centered treatments, installations and um, uh, all kinds of other stuff, like they don't always work super well because they're targeting
Yeah.
an area that's actually not
Yeah.
doesn't have a problem.
The
So
ladder's leaned up against the wrong wall.
yes, totally.
Yeah. So,
But that's why I'm so passionate about this, is just because there's so much misinformation. We can help patients. And I'm not saying it's simple. IC is actually is a complex condition. So I'm not saying it's easy, but it's certainly possible. So
yeah. Well, and to mention to listeners too, that, not only do you treat it, but you teach a course on it and other continuing ed courses too. Um, so that's incredibly helpful because, you've trained, thousands of PTs and OTs to be able to treat IC. So there's a lot of people spread out across the country and the world that are able to treat IC. But if you're looking for training, you know where to go. And if you're looking for treatment too, because I think you have a find a therapist listing as well, right?
yeah. So we have a practitioner map, and that's a more generalized map. That's not necessarily anybody that's taken any of my courses, but people can just reach out to me and DM me. We know a lot of people around that have, and that was just one of the interesting things, right? When I wrote the IC solution, I wrote it to patients, and my big thing there was that it's not only a bladder problem. It's pelvic floor rehab can really help. Pelvic floor PT, pelvic floor OT can help. And then I was getting a ton of like hundreds of messages back being like, well, I went to pelvic floor therapy and then, right, I was given only pelvic floor contractions, only Kegels, all the things, right? And so that's what really was the next impetus for me to actually be like, well, now I need to teach other people what the research says, what I'm doing, and then have that be sort of my propagation of good in the world. And that's been really exciting to sort of make sure that people are really learning about the condition in the way that we can help patients the best with all that evidence. So that's sort of the impetus to do that too.
So public health point for everyone listening, if you have bladder symptoms, where the ones that Nicole has mentioned, one of the things that she mentioned was that if you've tried pelvic PT or OT before and all they did was like pass over a list of pelvic floor strengthening exercises, aka Kegels, to do, that's typically the antithesis of what needs to be happening. And it's not that it isn't indicated in other issues, but, and you can speak to this, Nicole, obviously, but I just wanted to mention that because I think there's a huge misconception. I mean, if you just Google pelvic PT and you look at what some of the more prominent medical websites have to say about it, it's basically Kegels.
So frustrating.
And exercises. I was just breezing through the internet, down the street of the internet last night looking for something different, and I scrolled by a prominent hospital systems definition of pelvic PT, and I just had to stop and hold my head in my hands for a minute and just want to combat that kind of misinformation. But for everyone listening, if you do have IC symptoms or you've been diagnosed with it and pelvic PT or OT hasn't worked and that was their approach, Nicole, you can completely speak to this now.
Yes. It's okay to find another. Yeah. It's not that. Yeah. Just find another person. I think one of the biggest, really awesome things that happened in 2022, the American Urological Association guidelines were revised. And one of the things that it said is that Kegel should not be prescribed now for IC. Now, I will say that Kegeling, right, doing that drawing up and in of the pelvic floor, right, isolated pelvic floor muscle contractions, voluntary ones, there are other forms of pelvic floor muscle strengthening. So it's not to say that pelvic floor muscle strengthening should never take place with somebody that has interstitial cystitis, But as a patient, if you are having a bladder problem and someone says, do those things and you do them and they make your symptoms worse, that's the reason why we don't want to give those blanket advice to people.
Yeah. I've
Like
also
you
had
said,
people come in and try to just self-treat it. Like, oh, well, I just read online and I ordered A, B, C, D pelvic tools and I started
right.
using them and it made it worse. So yeah.
Right. And then we also have to acknowledge that you might have interstitial cystitis with stress urinary incontinence or prolapse or
Mhm.
something else. And so now all of a sudden, that's where you really need a true pelvic rehab provider to just help you to decide, how are we going to strengthen your pelvic floor? Do we need to? Is that the problem?
Yeah.
Or what are we going to do about your symptoms first? And then we can sort of create an individualized plan that makes sense for you and your symptoms. Um, but I was pleased when we at least had the AUA backing up that blanket, like,
Hmm.
1970s, looked like it just typed on a typewriter handout to folks that
Yeah.
talk about
Funny,
don't
not
eat
funny.
acidic foods and do Kegels. And it's like, oh
Mhm.
my gosh, there's so many things wrong with that
Yeah.
type of blanket advice, right? And the same
Yes.
things goes for, I know that you're very passionate about, nutrition and stuff like that as well. And that's another thing that we see with folks with interstitial cystitis is that they're scared to eat anything. They read that they're
Mhm.
not supposed to eat these, acidic foods. And now all of a sudden it's like they don't know what they're
They
thinking,
don't
that
know
they
what to
have all
eat.
this
Yeah.
these food triggers, when in fact they have pelvic floor dysfunction and a nervous system dysregulation problem, and it's not the food at all. But now we have this scapegoat that
Mhm.
allows us to not get in nutrition, and you're scared to eat, and that's a whole nother issue that we have to
Mhm.
address. And so that's one of the reasons why I feel like you got to get that individualized, evidence-based approach to what is actually happening and make sure that your practitioner is up to date on science.
Yeah, absolutely. And and it's kind of full circle. It brings us full circle back around to we were talking about with birth, with giving birth, which is like one of the most sacred experiences, of your life. That it is equal parts physical and equal parts mental, emotional, spiritual, psychological. And so is IC, if someone has made you afraid to eat, or if you read enough on the internet and it was you were misinformed, then I know, I think I speak for both of us, we don't want to let fear be the driver for creating the program for you. It should be liberating when you go to someone and they go, you
Yes.
can do this and this and this. And, and they really listen to your goals, because if someone's not prioritizing your goals, then, well, your needs aren't being met, you know.
Absolutely. Yeah. And I really, I've had so many patients that are now in like a disordered eating type
Oh
of
no.
scenario, right?
Yeah.
Because they're
Yeah.
so trying to figure out that kind of stuff. Um,
And it's
and
so prevalent anyway for particularly women to have body dysmorphia issues and eating
yes,
issues that, yeah, the
yeah.
last
And
thing that
that's
we want to do is be responsible for making that worse.
absolutely. So again, to anyone out there that is maybe struggling with that, and make sure that your practitioner, I love what you said, is listening to you and creating an individualized plan for you and your pelvic health history and your actual history that includes help on all of those fronts. I mean, that's the beauty of I know that the quote biopsychosocial approach is sometimes overused, in my opinion, as like a little bit of a buzzword. But if you really think about
Hmm.
what you should be expecting of a practitioner, and what we should all be striving for as practitioners, is to look at somebody in front of you with those different lenses, and then treat each of those things as a whole. I think that really is where we all need to be striving to be, either in receiving services or administering them.
Right. Yeah. So there's just a lot of messages for if you're listening as a clinician, if you're listening as a patient, and as a clinician, we're both, we are also patients all the
Yeah.
time too. That you want to feel like you're seen and heard, and that your practitioner standing with solid science. So, to that end, speaking of solid science and compassionate care,
Yeah.
make sure that you visit pelvicsanity.com. And if you're looking for training, Pelvic PT Rising,
Yep.
and you're on Instagram, but what is your handle? Tell us what your handle is there.
So all my patient facing stuff is at Pelvic Sanity. And if you're a clinician or a practitioner, you're probably better served following at Nicole Cozine DPT.
Okay.
But you
Okay.
can DM me on there. You can find all my contact information on there for both my clinic. We have remote consultations. We have an out of town program. We have a really awesome team of people that we have PTs and OTs on staff at Pelvic Sanity, which is great. That's the brick and mortar clinic in Orange County. And then obviously all my online education stuff is Pelvic PT Rising.
Yeah, so you guys, please check out the show notes. We'll be dropping some links in there, so it makes it really easy for you to visit. And Nicole, thank you so much for
Oh,
joining me today.
thank you so much. What a wonderful conversation. I really appreciate all of your work and everything that you do. And thanks for having me.
Thank you.